Hi, my name is Tracy Hutchinson, and I am an independent broker. I'm located in the Henderson, Nevada area. I am contracted with most major private insurance carriers that provide you choices for your Medicare Advantage, Medicare supplements, and your Part D prescription drug plans. I've been specializing in Medicare since 2004, which was, believe it or not, prior to the implementation of Part D benefits. And so I guess that makes me getting old because I've been at it for quite a while now. As brokers, we can provide you with unbiased and educated information to help you choose a plan that is going to fit your needs best. Broker services are always no cost to you. We get paid by the insurance carriers to provide that service to educate you. And before I continue, I have to get a pesky government compliance disclaimer out of the way. Neither I nor my business is employed by, contracted, or affiliated with any government agency. I do not offer every plan available in your area. So please contact Medicare.gov or 1-800-Medicare to get information on all of the plans available. In this video, I'm going to cover the complexity of Part D, which is the portion of Medicare that covers your prescription drug benefits. I know it's more dry information, but I promise you, if you stay with me to the end, I am going to give you some information and advice, guidance on how to effectively use your coverage and how to help keep your expenses as low as possible. And I think most of us want our drug coverage to be lower cost if we can help it anyway. For effective plan searches, what I usually do with my clients is I get a list of the medications, I plug them into a search tool that then provides a side-by-side comparison to see which coverage will provide the least annual out-of-pocket expense possible. So be sure to stay to the end. As I said, I'm going to give you some extra tips throughout the whole presentation. And do me a favor, if you like this video, please hit the thumbs up and subscribe and share this so that YouTube algorithm will display it to others looking for the same information. So now let's get on to why you're here. I want to start with how you get covered. So you can either choose to have a standalone prescription drug plan. So if you're going to keep your Medicare A and B as primary and you pick up a supplement as your secondary, then you'll need the standalone prescription drug plan to give you that Part D coverage. Or you can choose a Medicare Advantage plan, which includes the prescription drug benefits. And then I know, though, that I do have the clients that say, well, I don't take medications, so why do I need a plan? Well, because if you don't pick up a plan or you don't have other prescription drug benefits that's considered credible coverage, then you will be assessed a 1% penalty for each month that you don't have one. The penalty gets assessed based on the national average each year, and in 2023, that's going to be $31.50 a month. For example, if you went 12 months without having a plan, you will forever pay that 12% penalty. So it'll equate to $3.78 per month that gets paid to Social Security. So on top of any potential standalone prescription drug plan premium, you're going to pay that to Social Security. Plus, if you do have a Medicare Advantage plan with $0 per month premium, you still have to pay that $3.78 to Social Security. So now let's cover how medications are billed to your coverage. Typically, it depends on how your medication is prescribed and where it gets administered to you. There are 4 potential areas where medications can be billed. First is your Part A benefits, or also your inpatient hospital benefits. If you're in the hospital requires that they provide the medication to you for your safety and their liability, and also for their ability to control dosages according to your condition. So this means if you're covered under basic Medicare, your Part A benefits are going to be billed. If you're under a Medicare Advantage plan, then also known as Part C, then that plan will be billed according to the contract terms. And second way is through your Part B benefits or your outpatient benefits if medication is administered in a provider's office. So, for example, cancer drugs or some osteoporosis injectables, infusions, your durable medical equipment such as CPAP machines and nebulizers fall under your Part B benefits. And Part D benefits are billed when you pick up the medication at a pharmacy and you're just giving it to yourself at home. But other things like diabetes supplies or some vaccines like the shingle shot can be billed under Part D as well. And a hybrid of all this is what's called brown bagging or white bagging. And these terms are not typically known, but they're becoming more and more popular, so they're worth mentioning. This method typically applies to specialty medications. Brown bagging is when a pharmacy delivers them to you, or you pick it up at the pharmacy, but then you take it to your doctor's office for them to administer to you. White bagging is when a pharmacy delivers directly to your doctor's office and then they administer it to you. That typically happens when it's a temperature sensitive type of medication. And this is a growing trend, believe it or not. These are typically medications that were once billed under Part B, but this method shifts the coverage of drugs that are administered in a medical office from being billed under Part B, your medical portion, to a pharmacy benefit, your Part D portion. And so it's presumably at a lower cost. If you want to read more about it, I did put a link in the description to get more information. So let's get on to the structure of your Part D plans. If you've seen my other videos or have worked with me, then you know I like to use the analogy of building a house, which I feel provides the best way to explain all the parts of Medicare in general. You have the foundation, which are your parts A and B, but the rest is how you finish that house, so to speak. So Medicare creates the framework, and part of the framework includes the way all Part D plans are structured. The Center for Medicare and Medicaid Services, or CMS, establishes that framework, but you get your coverage through private insurance carriers, and they must follow that framework. All plans are on an annual contract with the federal government, and they run January 1 through December 31, regardless of when you start your coverage. So if you start your plan, let's say September 1st, it will end December 31st. You get the annual enrollment period to make a change, or if you like what you have and it still looks good for you, then it will just renew for the following year. I do usually recommend that you take a look to make sure that your plan is still going to cover your list of medications, even if you've had no changes for the following year. Every plan is structured differently, and insurance companies who sell them may have 2 to 3 plans with different formularies designed for different needs or medications. A formulary is the list of medications that your plan covers. So a tidbit of information here. Part of the framework requirement is that each drug plan must provide you with at least 2 medications per category and a minimum coverage of 6 of the protected drug categories, which are number 1, your anti-neoplastics, which are cancer drugs, number 2, antiretrovirals, number 3, anticonvulsants, number 4, antipsychotics, number 5, antidepressants, and number 6, immunosuppressants. Also part of the framework includes how and when you will pay for the medications, which includes 4 separate stages. On your screen, you're going to see an image that shows the 2023 numbers in each of those 4 stages. So let's start with stage 1. It's the deductible stage. In this stage, it's the highest deductible any plan can charge in 2023 will be $505. However, as I've mentioned, some plans can be lower or some will not have a deductible at all. I want to mention a tidbit of information here as well, and this just applies to all insurance, even a non-Medicare under 65 coverage. plans are structured to be the more you pay per month, the lower you spend when you use your plan. But that doesn't always apply to every single person. I mean, it's not the perfect scenario for every person, is what I should say. That makes sense. Um, I'm sorry, what makes sense for you is based on your needs and healthcare requirements. For Part D, it's based on your list of medications. So let's get back to the deductible. Depending on the plan, you must reach that 505 deductible, and then you go into making co-payments, specified co-payments or co-insurance, which is in stage 2, and that's called the initial coverage limit. However, some plans are structured where you don't have to meet the deductible if you're taking a tier 1 or 2 medication. And I'll get to the differences of the tiers shortly, so stay with me. In many plans, you're going to go right into making a copayment for your tier 1 and 2 drugs. Stage 2 happens when members and the insurance company are sharing the cost of medications. The official structure is when the insurance company is covering 75% and the members covering 25%. But how you'll see it in the plan is the copayment listed for the various tiers. The member stays in this stage until the insurance company has paid out $4,660 in retail cost of medications. When that happens, members are then moved to stage 3. Stage 3 is when is also known as the donut hole or the coverage gap zone. In this stage, the pharmacy company or manufacturer is going to take over, and they're going to pay 70%, and Medicare pays 5% of the cost. Then members are responsible for 25% of what's left over. However, some plans provide coverage for tiers 1 and 2 in this stage. Members move to stage 4 when that expense reaches $7,400 out of the member's pocket. Stage 4 happens at that point, also known as the catastrophic stage. This is where the pharmaceutical company stops paying. Then Medicare will pay 95% of the cost. Members are then responsible for 5% of the cost, or $4.15 for generic, $10.35 for brands, whichever is greater. Members who reach this stage will stay here through the remainder of the year, and currently there's no cap to your Part D prescription drug benefits. It's important to mention, though, here that the Inflation Reduction Act of 2022 created changes to Part D coverage overall. In 2024, the 5% cost share will be eliminated and drug costs will then be covered by Medicare. And in 2025, there will be a $2,000 out-of-pocket cap. And I have a link in the description to my more recent video that I did for 2023 Medicare changes. And that I explain more and cover more about the future of your Part D benefits. So let's talk about the tiers. I promise I'm almost done, so bear with me. A formulary on a plan is divided into tiers of medications, which are typically 5 tiers, and now you're seeing more with 6 tiers. This is where plans vary based on where they place the medication on the tiers. Tier 1 is preferred or common generics, and typically there is a low or zero copay in this tier, and often they exclude, like I mentioned before, the deductible, which means you don't have to pay that $505 first. In tier 2, medications include some common generics and some brand name drugs, and there's often also a zero copay or a lower copay, and often excluded from the deductible as well. Tier 3 typically includes preferred brand name medications and are a higher copay, and you typically need to make that deductible payment first before you make the copayment. And tier 4 typically includes least common brand prescriptions and some specialty medications, and typically you'll pay a coinsurance or a percentage of the cost of the contracted amount after you've made that deductible payment. Tier 5 happens, Tier 5 is typically specialty medications such as biologics or cancer drugs such as chemotherapy, cream. Just an example, you will most likely have a coinsurance percentage share in this tier as well. And before I end this, I'm going to give you some more tips on additional helpful information when you use your plan. A common thought I hear from clients, first of all, is that they want the highest cost plan because they think that they're getting the best coverage. Typically, the higher cost plans are good for those who are on higher cost medications. Also, the cost isn't really the best way to select your plan. You have to choose a plan that is based on your list of medications and which plan will cover them best at the least annual out-of-pocket expense. So that does bear repeating. So tip 2, you can only make changes to your plan at the annual enrollment period, which is October 15th through December 7th. So if a provider prescribes something new to you during the year, their office will typically not look to see which medication is covered under your plan. There are literally hundreds of different formularies out there. So provider offices just don't take the time to look them up. But what happens is when you get to the pharmacy, and if you find out something isn't covered or it's more money than you thought it would be, ask the pharmacist if there's something else on a lower tier that you could take. And if they can, the pharmacist will change it out. Otherwise, you get on the phone to call your doctor and see if they can prescribe that medication to you instead. And tip 3, if you do get prescribed a medication not on your plan, then be sure to check out discount options. For example, cleverrx.com/benefits of Nevada. Links are in the description, or goodrx.com. I'm surprised to learn actually that more people don't know about these options. So how they work is you go to their site or you go to use their app, you plug in the name of the medication and make sure you're doing the right dosage. And for example, if you're getting 30-day or 90-day supply, you need to include that as well. And then it will display the pharmacies that have it at the lowest cost and a coupon. And you go to the pharmacy and you just show them the coupon, and that's the cost that you'll get. And number 4, tip 4, carriers have contractual arrangements with different drugstores. So some are considered preferred and some are considered standard, which does make a difference in the copayment you make. Be sure you're using a preferred pharmacy. If you are using an agent or a broker, they should be telling you which is a preferred pharmacy and which are preferred pharmacies for that plan. Tip 5, for extra financial help, apply for low-income subsidy through Social Security, also known as LIS. In 2022, the threshold to qualify for that is 135% of federal poverty level. If you're over that, then you don't qualify for that. The 2022 Inflation Reduction Act will change that level to 150% of federal poverty level in 2024. Which does estimate that another 400,000 people will qualify based on that. I do address this further in my 2023 Medicare update video. And tip 6, you can also check your state's pharmaceutical assistance program to see if they provide cost coverage. I know in Nevada, Senior RX is the name of that, and they only cover the premium of a drug plan. And you do have to qualify financially and live in the state for 12 months or more. And tip 7, if you can also qualify, apply for state Medicaid. They do have their financial requirements and they vary state to state, but a tip on when you're going to go apply and you're looking for how to do that, go to your browser type in apply for state Medicaid in whatever state you're in, and then make sure the results that come up, you're clicking on the ones that end in .gov to make sure you're getting to the right website. I know that's a lot of information and I realize it's overwhelming, but I hope you found it helpful. I also remember that I am somebody that can help you through all of this. I'm a broker, just like you have just like I have a CPA or a bookkeeper that helps me with my business because I don't want to know IRS rules. I am the professional that does that for you. So again, do me a favor, hit the like button and subscribe, and be sure to share this. The more views I get, the better chance I have of being found. And if you want ethical professional help, please reach out to me via my contact information in the description. And I appreciate you coming and watching and taking time to learn this information. I hope you found it helpful. Give me some feedback in the comments. Thank you.